members of the media, representatives of WHO, SPC, and FHSSP, members of the Ministry of Health, ladies and gentlemen, a very good morning to you all. Yanuda Island. In 1995, at the first meeting of Pacific Health Ministers, a Yanuda Declaration was made on Yanuda, where we are today. And what it said was very prophetic and visionary. Essentially, the message of the Yanuda Declaration was that we would nurture our children to the best of our ability, that we would work with dignity, and that we would age with grace, that we would look after our environment, and that we would look after the ocean which sustains us, and that we would take pride in our ecology. That was the message. And in the last 18 years, in dribs and drabs, we've made progress in a lot of areas and not in others. So when we talk about Yanuda, to all Pacific Health Ministers, it's homecoming. It's coming back to the base and charging up your battery for another several years ahead. So it gives me great pleasure to welcome all of you to Yanuda Island. For this workshop, this NCD workshop, specifically for the media, so that we know where we stand and how we can forge ahead with the Yanuda Declaration in mind. We know the role of the media. You play a very important role. There is a commercial component. There is a component to inform, to empower your readers or your subscribers, and to make people think. And also, we realize that you have a social corporate responsibility. And today, we offer you a partnership in health and wellness. You all know that non-communicable diseases, or NCDs as we call it, is something which is, we also allude to as a communicated disease. This is in reference to the fact that NCDs originate from behavior and lifestyles, and which get communicated to young people from family members, from peers, elders, and friends. So we also know and we also infer that there are social determinants to NCDs, which play a major role to what you do with your lifestyle. We also like to elaborate that the target of this seminar is to influence and to engage you with knowledge. And you know that knowledge and information is power. It's powerful. And with that engagement, you may be able to participate. And with that participation, you may be able to empower the people of Fiji to take ownership of their health. Because ownership is sometimes a miss. And when you don't have ownership, a lot of medical and health programs fail. So far, the Ministry of Health has been looking at NCD, has working with the media on problems, trying to identify the causes, and I think it is time to take us up several notches to be able to develop a partnership with the media and to be able to give the ownership of health to the people of Fiji. The state cannot continue providing all these components alone. We also know that the Pacific and the globe is in a crisis situation. We are no different. In fact, some of the statistics are appalling, and it's very worrying because what it does, it creates a state of ill health. 20%, just under 20% of hypertensives in this country, and close to 16% with diabetes. These are frightening statistics. With our improved database, we're picking up a lot more cancers now. So the story goes on. And how do we address these issues is the question I raised to you today. For your information, we look forward to 3 important study results which are due middle of this year. This is a STEP survey, the second STEP survey in Fiji. We're looking forward to the oral health survey which was conducted last year, and we are at the tail end of a salt assessment survey also to determine the amount of salt we're consuming, which contributes to hypertension, strokes, and other adverse health risks. We are probably one of the first countries in the world who have adapted to the best buys approach on NCDs. The best buys approach, ladies and gentlemen, is that in September 2011, at the UN meeting, the best buys approach to address NCD was raised. Essentially, it targets 4 areas, and we're looking at that, and we've developed a scheme. We've endorsed increase in taxation on sin goods, and a large part of that money has come back in our conquest or our attempts to address the issue of NCD in our country. And whilst the rest of the world is still looking for an overarching policy, we have forged ahead, and that is to our benefit. Now, as I said, we need a game changer. We need to change how we conceptualize health and how we move ahead in addressing the issue. Because, as I always say, that we have a lot of strategic plans, business plans, corporate plans, you name it, we have it. But how does that impact on the lives of our common citizens? How are we going to operationalize all these plans and benefits? Yes, we need an infrastructure, we need to move ahead, but how is it going to benefit our people? And I think this is an important point in time where we need to move ahead and be able to make the necessary change with partnership with various organizations, including the media. We have moved away from treating illness. We're moving to wellness. With the amalgamation of the health promotion unit, with our NCD unit, we have the wellness unit, and we're extending the wellness into the periphery, and we're looking at wellness now. And we need to be able to incorporate healthier lifestyles. As you know, when we are born all healthy, but somewhere along the line, we cause ill health to ourselves. So this workshop, ladies and gentlemen, is an opportune time to relook at the strategies where Ministry of Health review what we have done so far, and then move ahead with what we possibly need to do in the future. On the second day of your program, I see that there will be issues you can raise, discuss, and come up with further strategies which we need to put into action. We are the first country in the Pacific to organize a conference or workshop of this nature, where the media has been invited and actively will be taking part with the Ministry of Health in addressing this issue. And I'm quite sure the impact of this meeting will, of course, trickle down to our Pacific neighbors, and I am quite confident that at the Pacific Ministers meeting in Samoa in July, there will be great interest and query about how we went. Therefore, I feel that it's very important that we put in a monitoring and evaluation component into what happens after this meeting. It's not a meeting where you attend, you enjoy, and you go home with a few messages which you forget thereafter. So let's make it something memorable and active. Finally, looking at the important issues, this is, as I said, it's a two-pronged approach. Number one, we are looking at advocating what the media can do, and thereafter we hope that we can partner a education program, a sort of widest of access to people in educating them and giving them the ownership of health. And all along the way, you would also partner it for yourselves as a media group, as a lot of the corporate organizations are currently undertaking or engaging people in workshops, in screening, in undertaking walks collectively or as a group, which you may not be able to do individually. Now, ladies and gentlemen, there's two components which I just wanted to mention before I finish off, is that the media needs to really look at investigative journalism in this area. And I challenge you to rise to the occasion and provide the nation with good investigative stories, and which can have a positive effect, a motivational effect on individuals who may be sitting on the fence. The patients who may be diabetic but denying that they are diabetic, or the hypertensives who are denying that they are unwell. So if we can work together and motivate the people of Fiji, it would be of great benefit to you and I. On the downside, sometimes I've been approached by reporters who lack basic knowledge. They just want to fill their pages on a certain day, and they have their agenda. And sometimes there's delays in giving you information. And I apologize for that, but you must realize we have a large organization. We have our agendas too. We can be in the thick of things. And, sometimes it takes a while to respond to you. And I encourage you to use the services of our media liaison officer, who is always available to you, I hope. Sometimes, recently, when I was at an international conference in Dhaka, and we're talking about population dynamics, and we're talking about issues with regard to engagement of media. And I was quite surprised that very little in the rest of the world has been done with the social media. And we were the only people who had attempted to go on and provide some sort of program for young people between the 15s to 25 with information, especially in the area of adolescent health, sexual and reproductive health, contraception, that sort of information which young people may find difficult to engage others in. So the social media provides an appropriate platform. And we have made 2 attempts to get it right, and I'm quite sure we're working on it so that our Facebook program is another option where the media could be involved in engaging the public of Fiji. I would like to thank the Secretariat of the Pacific Community, Dr. Samuela and his team, WHO and the team, and Dr. Margaret Cornelius representing FHSSB, for all the support they have provided in these areas of health promotion and wellness, and for making this workshop possible. And as I've said, it's a little like rugby. It's NCD management or working with the media. It's touch, pause, engage. So I hope we will touch each other and we will pause and think, and then we will engage in the serious business of addressing NCD issues in Fiji. I thank you for your time, and you have a wonderful 2 days. Thank you.